Okay, let's start with, introduce yourself and talk about your experience before the field epi training, during field epi training, and after field epi training.
Thank you, Alan, for this invitation. Yeah, so my name is Dr. Wilbrod Mwanje. I'm a medical epidemiologist, currently based in South Sudan, where I'm coordinating the DHIS2 COVID-19 data management project, as well as leading mentorship to the FEP frontline program, which is a program in infantry here in South Sudan. So before field epidemiology training, I implemented or practiced field epidemiology in more or less an ad hoc manner at the district level, where epidemiology functions, disease surveillance, outbreak investigation, they were really nested or integrated within primary health care at the district level, which seems to be the major focus at the time, largely focusing on curative services. And the other really key epidemiological functions were most of the time implemented on an ad hoc, really not so well structured manner, and that was at the district level. Yeah, so during the training and even after, there are key competences that I managed to achieve here as a practitioner in outbreak investigations, scientific writing. I've had opportunities to make presentations to national level, meetings, workshops, but also at international conferences. So, those key competences on scientific communication and getting to participate in implementing research, surveys, both at national and, subnational, but also, international level. Those are some key things that I have, continued to build even after the training through continued practice and helping me to improve or get better every other day, getting to do it on the job. Yeah, so that's a little experience before and after.
Thank you, Wilbrod. Could you share through a couple of experiences of your fieldwork experiences, how collaboration has helped you in your field epidemiology practice? I'm asking because this podcast is being released as part of our activities for this year's World Field Epi Day, and the theme for this year's World Epi Day is collaboration is key to field epidemiology. So could you share a couple of your experiences? Collaboration.
Yeah, so collaboration is key. As we implement these public health programs, there are different players who wield different levels of influence. Yeah, so those players, call them stakeholders. It could be government, so ministries, training institutions, frontline implementers at the district or county level. Yeah, so after my training, I've had the opportunity to implement a couple of surveillance projects or programs. The first one was the Global Health Security Agenda immunization project that focused on, efforts to improve measles surveillance, but also push the drive towards its elimination in Uganda. So we had, different players, including the Ministry of Health, who really hold the mandate. They hold the mandate for implementing the public health programs. And ours was a supportive role, providing, the technical expertise, running our epidemiologist skills to implement, but also be able to monitor and, report on the program, its successes and, challenges and the learned lesson. There are a couple of others, stakeholders, like the WHO, who are really the lead technical players or stakeholders, and they have had, usually a longer presence in many of the countries, for Uganda. So as the epidemiologist coming up under AFINET, WHO, which was more rooted, had a better understanding of the system. They participated in establishing the surveillance system. So they came, as a key partner to support the project, provide some guidance here and there to ensure that even as we do the implementation, it is within the standard, the guidelines that they have set out. The integrated diseases surveillance and response, because the surveillance, the measles project was being implemented in the context of IDSR, and IDSR is the brain of WHO. So they were a key partner in assuring that as we implement, as we support the move towards global health security with a focus on measles, it was still within the agreeable standards for a country like Uganda, which is in the Afro region. Other players were at the district level. That is where the outbreaks occurred. So if they didn't report the incident to the national level, we would never get to know that there is a problem in a certain district, in a certain location. Yeah. So their role was to do the reporting, and as the national level teams, rolled out to support the investigations, it was still within the joint effort of the frontline teams at the district level, who know exactly the kind of populations that are being affected, their locations, but also their attitudes and expectations. So understanding each stakeholder and the level of influence that they offer, or largely impacts the success of surveillance program. The example of the one we did on measles elimination efforts in Uganda. I can give you a second one. The one which I've done here in South Sudan, when COVID-19 came, there was the rollout of new vaccines to try and combat the epidemic. So South Sudan was one of those countries that rapidly rolled out vaccination programs. The rollout of the vaccines, came with the need to collect the data to monitor, the program success, but also to use that data, in some key decisions. So the data was collected initially using, aggregate numbers on a system which WHO rolled out. So WHO played a pivotal role in the rollout of the vaccine, and also collecting its data, the program data, using a system that aggregated the data, which was ODK. So my coming on board was now to roll out a new system that would digitize the data that is already collected in the registers. So, we had different players here with different expectations. WHO that was leading the rollout of the vaccination exercise and primarily collecting the data and, leading on the reporting, but also the Ministry of Health, which needed to utilize the data to make some key decisions. Now, the response to COVID-19 in the country here, was under the Epidemic Preparedness Directorate or Department, if I may call it, in the Ministry of Health. But data management roles are with another department, which is managing, policy, research, and data management. Sorry. So whereas the PR department was very much interested to see us get this data and avail it to them, other department which had the custodial role or functions of the DHIS2 and other data management systems did not easily buy in. So whereas both departments belonged to the same ministry, the same government, there was a bit of conflict, and that stalled the project. Because one of the players felt that their expectations were really not met. But also in the initial in the drafting of the project, there was probably limited participation of that stakeholder. So the EPR, who was leading the response, quickly saw the need and bought the idea of collecting the data. So at that time, there was no involvement of the department which actually held the custodial roles of the DHIS2, which we were actually coming to use. So that held us, it slowed us a bit on the implementation. So those are two stories. One on how the failure of collaboration, limited success, and then the other one in Uganda, where collaboration enhanced program project. Yes. Over to you, Alan.
Okay, thank you, Wilbrod. I appreciate you sharing those experiences. The other question I wanted to ask you is how do you see the role of field epidemiologists contributing to addressing public health events, particularly going forward as we are dealing with Mpox and other emerging pandemics?
One of the roles for epidemiologists is in really gathering data and analyzing it. So now for some of these disease events which are new, or those that are re-emerging, some re-emerge with a different face. So epidemiologists will be key in collecting information on how the disease events are presenting in different locations, and also helping to identify those that are at risk, using the data to do that identification of those that are at risk and those that are most affected, which can help to guide control and implementation of interventions that are going to cover these disease events. So data will definitely be used to prioritize, particular interventions. I'll give the example of vaccination. If we are going to roll out Mpox vaccination, we are definitely going to rely on data. So epidemiologists, based on what they have learned from the data that they collect, will be, pivotal in providing that key information which ministries, governments, can benchmark to take critical decisions on who should be targeted, maybe in terms of age groups, or maybe in terms of locations, maybe in terms of occupations that place those particular persons at risk. So that is one key role, data analysis, and communicating that data to decision makers, who are involved in containing these epidemics. The other one that is pivotal is definitely the investigations. Outbreak investigations usually come, to help in identification or the detection of these events. These events, in what magnitudes and the drivers of these events. Again, all that is information that is key to to implementation of control measures for these disease events.
Just one last question. What do you see as the role of collaboration in outbreak investigation?
So collaboration is key, in outbreak investigations. So if we look at how outbreaks are lately moving, heading from one locality to the other side of the continent or the other side of the globe. So collaborating, whether with the governments or whether with the health workers, surveillance workers at different levels of the reporting or surveillance system, is really key for us to garner information quickly on possible times when the events could have probably started, or how they have actually affected the populations there, and how cases may have traveled from one locality to another. So the collaboration, is key to helping one to contain or break that chain by really gathering information and most of information in real time. But also having an enabling environment that shares out that information to different players can help to achieve timely control of epidemics. So this collaboration really not only for the investigation, which gives the information, but also when it comes to merging forces. Yeah. So if populations that are at risk get to be alerted in time and begin to implement the interventions that for each step, either the pre or the outbreak stage, it will help to limit the damage or the catastrophe, the level of impact that an outbreak would probably have had. Yeah.
Thank you very much for taking the time to answer the questions. We appreciate your involvement with this. That's all that we needed for the episode. And thank you for providing those very informative answers, those comprehensively informative answers.